Handle Your Business, a weekly podcast discussing a little of this and a little of that. Handle Your Business appropriately blends serious topics with fun topics, all in an effort to help you have a good or better life. So join me, your host, Lady Lashley, and some amazing guests every Sunday at 5 p.m. to explore everything from financial management to dealing with relationship challenges. Put it in your calendar every Sunday from 5 p.m. Tune in to Handle Your Business to get you ready for the week ahead. For more details, follow at Lady Lashley TT on Instagram and Facebook. Handle Your Business. Welcome to another episode of Handle Your Business with yours truly, Lady Lashley. Today, we're going to be discussing diabetes. I have with me Dr. Maxwell Adeyemi. He is a known and well-recognized specialist in this area, resident in Tobago for many, many years now. Very household name in the medical fraternity in Trinidad and Tobago where diabetes is concerned. Thank you very much, Dr. Maxwell, for joining me.
Thank you.
All right, so I just want to start with the cliched question, really, of what is diabetes and how does diabetes affect the body?
As you said, diabetes is a very common, disease and in the country. And the layperson possibly would just want to know what it means. And just to talk in terms of the lay term, so the common man can understand what diabetes is. Basically, diabetes is a disease that is characterized by increased blood glucose in the blood. When you get to a point where you eat, your food is converted into glucose, and that glucose is used to generate energy. Now, for this to happen, there is a hormone in the body called insulin that is produced by the pancreas. And this hormone is responsible for opening the, access into the cell for the glucose to enter so that energy can be generated. When there is a lack of insulin or there is deficiency of insulin production, either because the quantity is not sufficient or there is a defective, receptors of the insulin, some problem that occurs with insulin production and the glucose is unable to be utilized, glucose eventually will, at a very high level, and this glucose builds up in the blood, it becomes toxic to cells in the body, and this is exactly what happened with diabetes because the accumulation of blood glucose that leads to toxicity to the cells creates a number of complications for the body.
Okay, and so it is really...
In a nutshell, that is what diabetes is.
Okay, gotcha. High level of blood sugar that basically begins to complicate things for whoever is suffering with that. In terms of who diabetes affects, right? I know you said before that it can affect anybody, but can you share perhaps why it seems as if Black people are more prone to suffering from diabetes and diabetes-related complications?
Diabetes is not only a disease of the Black people, okay? It is just that there is a higher incidence in Black and Asian people and the Hispanics. It does affect practically every race and every ethnicity and every geographical regions of the world. However, for some reasons, the Black people, the Asian people, and the Hispanics tends to have a higher predisposition. We don't know why the genetics is like that, but that's just how some diseases are. They are more common in certain, races or certain geographical locations. Okay. However, it does affect every ethnic or every racial, composition within the global community. It's just that the Black people and the other races are a little more affected.
Okay.
And that, like I said, is a multifactorial, a disease. There's so many other factors that also influence the incidence and the preponderance of diabetes all across the globe.
Okay, gotcha. With respect to this disease, I know that children who suffer with diabetes. Can you say like how early exactly a person can develop diabetes?
Right. There are different types of diabetes, and some of them are common in certain age group. For example, the three major diabetes that we know that the general population are knowledgeable about to be diabetes, which is as a result of complete lack of insulin production. Okay, and this is one that is most common among the young people. However, adults above 21 and so too who also have type 1 diabetes, but it is commoner among young people. So between the age 0 to 5, sometimes we can pick up, type 1 diabetes in the young person. However, which is the type 2 diabetes, which is formerly known as the adult onset diabetes, is more lifestyle, although genetics do play another. Not a complete lack of insulin, but either deficiency in the production, insufficient production, or other reasons that may have occurred that impair the glucose production. Insulin production that create problem with glucose metabolism. So therefore, most people, maybe adults, by the time you diagnose the type 2 diabetes. However, because of the incidence of obesity and overweight, we are also seeing younger generations as early as 10, 11, and 12 years old that are developing type 2 diabetes. So the demographic features are changing based on, what is happening, across the globe in terms of obesity, lifestyle change, problems. The other type of diabetes is the gestational diabetes, which is really something that is triggered, the diabetes that is triggered during pregnancy, okay, because of the hemodynamics of pregnancy and the fact that the different hormone interplay that comes to play in pregnancy may create some level of insulin resistance that the body gets less sensitive to insulin. Women may develop diabetes in pregnancy. Most of the time, half of this situation will resolve after the baby is born, and the other half, about 50%, may possibly persist or develop diabetes within 5 years if no tangible lifestyle intervention and adjustment is undertaken. So these are the basic different types.
Okay. So 3 types, gestational, which develops in pregnant women, type 2, which is lifestyle based on how you live, what you eat, etc., and more so traditionally affected adults, and then type 1, which you say is the absence of insulin, and that's the one that really 0 to 5, that category of individuals, young children, they are usually affected by that one.
Yes.
What exactly can cause that lack of insulin in the early stages?
Usually is a genetic thing in most of these children. Okay, they're genetically prone. Some is because of some kind of infections or something that will have happened that causes a destruction of the insulin producing cells in the body, which is the island of Langerhans in the pancreas. Okay, so once that happens, okay, the body is unable to produce insulin, and therefore the glucose metabolism is unable to happen effectively in these patients, and therefore the only treatment that is available for such in type 1 diabetes is to give insulin. So such patients will be on insulin for the rest of their life.
Okay. With respect to type 2, and this is lifestyle, so this is how we live. I'm not gonna ask what we do to cause it, but I'm gonna ask what can we do to prevent new cases of the type 2 diabetes in particular, which is based on, lifestyle choices, how we choose to live our lives.
Yeah, basically it's about changing a lifestyle which involves, healthy eating. So there's a dietary component, a dietary change that is needed. Secondly, there has to be some degree of, weight control, okay, so that if somebody is overweight or obese, they need to drop their weight, okay, to put less burden on the body in terms of, requirement for insulin and stuff like that. Then the third thing would be that they have to make sure that they are active, in terms of physical activity, exercise, regular exercise and stuff like that. So once you're doing things like that, you'll be able to stave off the development or the onset of diabetes. And if such person has been diagnosed, then it will be very expedient that the person stick to their medication and make sure that they have the, disease under control.
Okay. Now, in the past in Tobago, I don't know if we still have a lot of this, but in the past, there used to be a lot of amputations. So we talked about what can be done to prevent like new cases of diabetes and so on. But for those people who currently are suffering with diabetes, what can be done to be able to not be amputated? Well, first off, I should ask why is there a need for amputation when somebody is suffering with diabetes?
Well, one of the complications that comes with diabetes is amputation, and amputation have its own what you call the pathophysiology, what causes it. All right. Now, in the beginning, I told you that when somebody has diabetes because of the high blood sugar, this high blood sugar is toxic to the cells. So there is destructions of the endothelial cells of the blood vessels. So blood vessels are destroyed. The same thing happens. The nerve supply to these areas are also destroyed. So there is what they call ischemic process, which means lack of blood supply, okay, or reduced blood supply. And there is also what they call the neuro component, which is nerve, destruction component. So when you have a dual situation where blood vessels are damaged, nerves are damaged, it compromises the integrity of the lower extremities to function effectively. So therefore, becomes a problem. So wound healing becomes an issue because you need blood and other nutrients and other, components that encourages wound healing. The next thing is that the nerves are also damaged. When nerves are damaged, what happens is you lose sensation, and therefore these persons are able to, they're not able to perceive, the sense of pain. So they may get injuries and stuff like that on the lower extremities, and they are not aware of it because they would not have proper feeling. And therefore, when you combine the not having, proper sensation of feelings of pain, and therefore they get injured or they develop a wound, and there's no feeling, they're not aware of it, it gets infected, healing becomes a problem, and from poor healing as a result of lack of blood supply, you may also have, life-threatening or limb-threatening infections, and this creates some other problem that may lead to gangrene, and amputation may be the ultimate, result if that is not properly managed.
Wow. Okay. So basically, apart from managing the diabetes, they have to look at things as like proper wound care and all of that in the event that they have a wound to be able to avoid amputation.
Right. They really need a fit inspected on a regular basis. They also need to be very conscious about, what they wear, and so that they can, minimize injuries and prevent any kind of, damages to their feet, so that, they will prevent any kind of infection that may lead to amputations.
Right. Why is it the feet? Usually when you hear about a diabetic amputation, related amputation, it's usually cutting off of a part of the foot or both feet. What's up with that as opposed to, I suppose, any other limb?
All right. Amputation could also affect the upper limb, which is the hand and the fingers, and that could happen. I've seen people with that. However, the amputation is commoner in the lower feet because that is the most distal part, the farthest part from the source of blood, in the body, which is the heart. So blood will have to travel faster much longer to get to the farthest part of the limbs. And therefore, if there's going to be damages to the blood vessels, it is usually the first, the finest and the smallest blood vessels that are damaged much, much easier, So the farthest part of the body, which is the lower extremities, suffer more from the brunt of, vascular damages than any other part that is closer to the heart. You remember, though, the closer you are to the heart, the larger the blood vessels that will possibly reach to such organ. And the farthest they are, the blood vessels are smaller. It's like you have water pipe from the mains, from the reservoir to your mains, and then to come into your house. You understand? The farthest they are from the dam, the farthest they are from the reservoir, the smaller will be the pipes. So the same thing that happens in this circulatory system, the farthest that an organ or a structure is from the heart, the smaller the blood vessels that will get to them. So they are more easy to get damaged than anything. So they are more, more compromised than the other part of the body.
Gotcha. Now diabetes, as you said before, can lead to several other complications. What are some of these complications and other illnesses that someone who is affected by diabetes can likely suffer from or with?
Right. Diabetes, like I always tell my patients, is a head to toe disease. It affects you from the very head, to the sole of your feet. So if you start from the head, obviously you're going to have issues with, the brain. So you're going to have risk of stroke, dementia, Alzheimer's. Those are things that will happen, on top. And then you go lower down, you could have issues with your eyes. So you could have, retinopathy, cataract formation, glaucoma, and all those things eventually will lead to blindness. Then you could get into the dental, the oral cavity, so you could have dental issues. You have periodontal diseases, gingivitis, and other, gum disease that may occur, and loss of teeth that may occur with diabetes. Then you move down a little bit to your chest, you get the heart. You will have different type of heart disease like coronary artery disease, heart attack, angina, and all those other things that will happen. And you move down into your abdominal cavity. Most persons that have diabetes eventually too may have what they call the diabetic stomach, which is diabetic gastroparesis, because the nerve damages to the stomach are also affected. You're going to have paralysis or poor motility of the intestine and the gut, and these people may be chronically constipated in some instances. Okay, then you could go to your kidney. Then you have kidney damages, and what you call diabetic nephropathy. And you go down a little bit into the pelvic area. You're going to have, for the men, you're going to have erectile dysfunction because the nerves and the blood vessels to the sex organ is also damaged. And also for the women too, you have a similar situation. Their sex life is affected, okay, because diabetes and high blood sugar will also reduce your immune system and ability to respond to infections. So you do have a lot of vaginal thing that will compromise sexual activity. And of course, we talk about the lower limbs, extremities that may lead to the infection, cellulitis, osteomyelitis, so amputations, which may be digital or whole leg amputation affected. They also have skin manifestations of diabetes. Diabetes come with myriad of skin disorders, from fungal infections to abscesses to bacterial infections and different things that with depression, anxiety, and other things that may come with, diabetes. And of course, in teenagers, you may have some psychosocial issues, self-esteem issues, depression, and suicide, and that may happen. So diabetes come with a whole, gamut of complications.
Wow. With respect to the, I suppose, everyday choices that we can make, in terms of how we eat, because every time you hear about diabetes, there's always some sort of warning about making sure that you eat the right foods and so on. Are there any specific foods for us in the Caribbean especially that we should be mindful of when it comes to preventing and managing diabetes?
Not necessarily with really this the concept of a diabetic diet is really a myth. Okay, as a diabetic person, you can eat just anything that anybody else is eating. The question will be then your portion sizes and the moderation in which you consume these food items. So you can take a little bit of everything, a little bit of this in a very controlled portion sizes, and you manage your diet, and stay physically active as your age may permit, and make sure you're taking your medication. So we do ask the dietitian and the nutritionist to guide you, okay, so that you know which food are available, what is the glycemic, index of this food, especially because some food has a higher, glycemic index, meaning that they increase your blood sugar much quickly and very high and very quickly. So those kind of food, you may possibly reduce their intake or minimize their consumption. And those that have very low glycemic index, then you can, make sure that you increase the consumption of those ones as well. So the the point I'm making is that you can eat just any and anything, but you can also make sure that you control the portion size and, eat them in moderation. And obviously, whenever you are eating, make sure you eat a balanced diet that contains not only carbohydrate, but proteins and fat and other, food component that is necessary for the body, and increase a lot of, fruit and vegetables in your diet.
Right. There are two things I want to ask about specific to foods. I know you say you could basically eat whatever, but a friend of mine, I like Julie mangoes, and a friend of mine kept saying to me, if I keep eating all them Julie mango, I'll get sugar. Because they say Julie mangoes, well, mangoes on a whole, I suppose, are very, they're full of sugar. Is it that the sugar in some of these things like Julie mangoes and ripe bananas and so on, is it much more higher than anything else? Is it more complicated than anything else? Or it's really, as I said, just eating a small portion at a time? And maybe what does a portion of a Julie mango look like?
Right. Like I told you, it's about the glycemic index of each of the food. Okay. 2 gram of mango and 2 gram of cake obviously will have different glycemic index, because one will have a higher glucose concentration per unit time than the other. So what you need to do really is, whatever you are eating, be moderate about it. You can also Google the glycemic index of each of these foods, so that you'll be able to know, okay, well, this one I can take in this moderation level, this one I can take in a little bit more in this, but you can eat very little bit of each of these things if you desire to eat them. Some people may be disciplined enough to come off certain type of food and stuff like that. And we also encourage people to kind of, reduce, especially refined carbohydrate, and take more of complex carbohydrate that takes longer in the body to digest. When I say refined carbohydrate, like the rice and the sugar and the flour and stuff like that, reduce their consumption and use more complex carbohydrate like the yam and the cassava and the dashin and stuff like that, because it will take longer for them to be digested in your body, and the process of metabolizing them is a little bit more, slower, and then you'll be able to manage the blood sugar in a more reasonable way than just dropping too much of, refined carbohydrate, like possibly if you take a piece of mango as opposed to taking a drink or mango drink that has been, laden with sugar and water. They are two different things. Yeah.
Right, gotcha. As we wrap up, in terms of caring, home care practices, self-care practices, etc., are there any specifics for people who are suffering with diabetes?
Right. What I always encourage my patient to do over time is for them to first train them and let them increase their self-efficacy. That is the ability for them to take care of themselves, recognize that I've got this disease and I've got to master the control and control this disease. So self-efficacy is very important. So you'll be able to take care of yourself in terms of self-discipline, diet discipline, physical activity discipline, and stuff like that. And if it's that this person has any kind of challenges physically or otherwise, because you may have some limb issues that make you physically challenging, or you have visual issues that make you, unable to do things. So families and, relatives can, be of significant help in those instances. But it's important that the person improve their self-care capacity, and then they need to also make sure that they do their routine checks. Okay, you have to see the eye doctor, you do your routine blood, do your foot when you go by the doctor, and the doctor can also teach you how to inspect and examine your feet, so that if you notice anything unusual, you contact the doctor immediately. And if there's problem with your sugar or glucose monitoring at home, then you consult your doctor. So we encourage them to make sure they do their testing at home to have a fair idea. Yeah.
Yeah. Okay. So you test at home to make sure what your blood sugar would look like, what it is. And last question as we wrap. In terms of if you are not a diabetic, as far as you know, don't have any diagnosis, but you perhaps want to check, or maybe what are some of the signs that people who don't have a diagnosis can, if they suffer from a certain symptom, they should get it checked?
Right. The thing that we want to encourage is for everybody to do testing, to check, which is the best preventive tool that we have. You start to check so that you can know your number. Now, people who need to be, screened up are people who are pay emphasis on people who are at risk. If you have family members who are diabetic, maybe uncle, father, mothers, auntie, and stuff like that, you need to be screened, because there's a genetic component to these illnesses. So once you have somebody in your family that has it, then you need to, if you have diabetes, if you've been pregnant before as females and you have diabetes in pregnancy, then you need to get checked. If you are obese and overweight, you need to also check. Most people who are above 25, we also encourage them to get tested. However, we know that, you are getting younger age group who are coming down with diabetes. So in terms of the symptoms, okay, people who are getting diabetic, you have frequent urination, frequent increased thirst and increased eating and stuff like that, sudden weight loss, recurrent infections, visual blurring, erectile dysfunction, poor healing wounds and stuff like that. And so those are the different things that, may come up, as symptoms that you may have, that will give you a pointer as to, okay, look, you need to get checked.
All right. Thank you very much for that. Poor healing wounds, repeated infections, frequent urination, all of these things are examples of situations where you need to get checked. Thank you very much, Dr. Maxwell. Very informative, even for me who may have been aware of some of the information. I think I still learned something from what you shared today. All right. We tend to have this discussion. So for those of you who are listening to this podcast, you can handle your business. All right. Go out there and handle your business. Check your numbers, get tested for diabetes, get screened, as Dr. Maxwell has said. Handle Your Business, a weekly podcast discussing a little of this and a little of that. Handle Your Business appropriately blends serious topics with fun topics, all in an effort to help you have a good or better life. So join me, your host, Lady Lashley, and some amazing guests every Sunday at 5 p.m. to explore everything from financial management to dealing with relationship challenges. Put it in your calendar every Sunday from 5 p.m. Tune in to Handle Your Business to get you ready for the week ahead. For more details, follow at Lady Lashley TT on Instagram and Facebook. Handle Your Business.